My name is Traci Butler Carroll, and I'm the Assistant Director of Education Programs in the Center for Geriatrics at the University of North Texas Health Science Center in Fort Worth, Texas. I would like to thank my co-authors, Dr. Janice Knabel and Dr. Jennifer Severance, for their contributions to this project. We are supported by the Health Resources and Services Administration and the U.S. Department of Health and Human Services. However, the contents of this presentation are the sole responsibility of the authors. The bottom line of this presentation is that a majority of health profession students feel that telehealth visits with older adults are equally or more effective than in-person visits at offering convenience, safety, saving time, and meeting their interprofessional and geriatric learning needs. In 2009, the University of North Texas Health Science Center created the Seniors Assisting in Geriatric Education program, called SAGE. The program goals are to strengthen healthcare students' skill in the care of older adults through experiential education, to increase interprofessional collaboration, and to engage with older adults in the community. Interprofessional teams of healthcare students are paired with volunteer older adults in the community called senior mentors. The teams visit their senior mentor at home following a set curriculum with a different topic at each visit to provide health screenings and education, safety assessments, and community resources. Experiential education like this is so beneficial for student skill development, but with the onset of COVID-19 in spring of 2020, students were restricted from visiting senior mentors in person. A workaround approach was quickly developed to prevent the interruption of education. We quickly adapted from in-person to an interactive online experience with asynchronous modules, telehealth training, and virtual team visits. Students completed pre-work, which included an introduction to telehealth and materials related to the topic of the visit. Students met virtually with their team to review and prepare for the telehealth visit. They then met with their senior mentor through telehealth. Students reconnected with their team afterwards to debrief and to work on their written assignments. And at the end of fall 2020, students voluntarily completed a survey that assessed their knowledge of geriatric skills, interprofessional teamwork, and virtual visits using a 5-point Likert scale. A total of 647 students completed the self-paced online curriculum and conducted telehealth visits, and 25.5% completed the voluntary survey at the end of the semester. The majority of students, 82.6%, reported that telehealth is equally or more effective than in-person visits at offering convenience and safety to older adults during the time of COVID-19, and 93.3% stated that telehealth is equally or more effective at saving time on the visits. A total of 65.7% indicated that telehealth is equally or more effective at meeting their geriatric learning needs, and 70.6% said that telehealth is equally or more effective at meeting their interprofessional learning needs. The program faced some initial obstacles. In-person activities needed to be replicated in an online format for maximum learning. We sought out or created interactive online content, evidence-based educational materials, patient case scenarios, and recorded simulated patient encounters to supplement the in-person learning. All of these were incorporated into the pre-work, which the students completed prior to their visit. An additional obstacle was the adaptation of telehealth by our senior mentors. Some did not have the appropriate technology to do an online visit. Others were unable to use their technology or were uncomfortable with the concept of telehealth. We also had senior mentors who were willing and able, but they had accessibility needs, which made telehealth difficult. These challenges were addressed primarily through education and flexibility. We offered an introduction to telehealth through educational flyers, newsletters, and even phone calls. And senior mentors were given the opportunity to meet with their students either by telephone with mailed hard copy handouts or by virtual online platform with a shared screen. Ultimately, all of our student teams had the opportunity to meet with their senior mentor. The SAGE program continued virtual visits in spring 2021, but as the primary goal of the SAGE program is to provide experiential education in the community, tentative plans are being made to move to a hybrid approach in fall 2021 as COVID-19 restrictions relax. I appreciate your time today. If you have any questions, please scan this QR code to email me at traci.butlercarroll@unthsc.edu. Thank you.